In comparison to the female sexual anatomy and physiology, this chapter is a little bit shorter. However, some people have discussed as to why there is less content for this. Well, one, it has to do with how the female is able to also conceive a child and carry a child within the body for a while. So the pregnancy is a very complex process. The male, while of course playing a role in this in here, however, does not carry the baby within. Nor does the male really have a function in his breast, although there may be breast development, which we call gynecomastia because of hormonal reasons. There isn't necessarily a function to our breast. Now, as we go through the process of understanding our body, it would seem as though men would be more open and informed about their members, that is, the reproductive system, specifically their penis and testicles. After all, it is held on a regular basis to pee, and it is easily accessed without any invasive or intrusive processes, whereas women have to get a little bit more invasive to access different parts of the reproductive system. Nonetheless, when we ask the question of how well men know their body, it seems that there may be an ambiguity or a distortion of how well we know our body. In 2008, there was not 2007, there was a documentary named My Penis and Everyone Else's, which you will get a chance to watch. And you will see how this particular documentary challenges society's stereotypes of masculinity by getting to the heart of how men are sometimes defining how masculine they are based on the size of their members. There is a lot that's connected to this in here, and while we consider all the different aspects that may be important for men as to why their penis must be in a particular size or a particular shape, we find that there is pressure coming from both ends. The men who may be fascinated with their own penis and the size of that, and women as well, which may be responsive to what media, perhaps pornography or sex toys, depict the penis, the average penis, to be. It is important for us to know that the penis comes in various sizes, and it is not necessarily consistent or congruent with the body size and or shape. When we look at individuals, depending on their body type, it may vary significantly depending, again, on the individual. And we find that the most common correlation that exists is not necessarily with the size of the feet or with the size of the hands or with anything else. The strongest correlations we've found have been between the male's father's penis size and his own. When we look at individuals that may have muscular bodies, you would see that also the testicles vary depending on how the individual may be positioned in here. And so depending on the posture, there are some individuals that are called out there, and this is not necessarily scientific language, but they call some people the showers, and those are individuals who may constantly have an elongated penis any given moment. And then the growers are those who may have a relatively short penis when not erect, but yet when it becomes erect, then there is an increase in size. In any case, we'll look specifically at how the penis influences and is used for reproductive purposes. The penis has been a cause of anxiety for many men throughout history. We find that the average flaccid penis size is 3 to 4 inches. The average erect penis is 6 inches. This is interesting because, as you will see in the documentary, the ways in which we gathered this data were very flawed. Individuals were given a ruler and were asked to go into a room, measure their penis, and then come out and report to us. Naturally, a lot of men, because they associate their penis size with how desirable they may be and how powerful they may be, we see that many of them lied about their average size. We find per a study in 1995 that only 50% of men have an erect penis measuring more than 7 inches. And again, when we look at the penis, it is one that's associated with a lot of power. Within the locker room and various other places, you find that individuals who may flaunt or show off their penis or use it as a way to demonstrate their power seem to be associated, some people would say, with more the animalistic view. The cognitive perspective would say that the largest sex organ is not the penis, but the brain. Nonetheless, we understand and recognize that the penis plays a significant role in the reproduction, and that is basically fulfilling the purpose of life according to the evolutionary perspective. So the penis is made up of 3 cylinders of erectile tissue. There is no bone, there's very little muscle that we have in there, and the erections basically help to penetrate the vagina and deposit the sperm as near as possible to the cervical entry, and that is what we call the os. Now, the reason why the length would be important to a certain extent is because the vagina is actually a very acid environment, and so if the sperm were to be short, if the penis were to be short and it is not deposited as close as possible to the cervix, then there's a higher probability that you would not be able to impregnate a woman, to fertilize an egg. And so that's why erections and the size of the penis may matter. Also, it's important for us to know that unlike women who have a urethra through which they urinate, and also a vaginal cavity through which they have sexual intercourse and the menses are released and give birth to a child, the penis only contains one cavity, and that is the urethra for urine and for semen transport, and that is through here. And we'll look at how the anatomy internally gives way to the release of the semen and the urine differently. The penis overall is composed of 3 cylinders of erectile tissue. You have the corpora cavernosa, that's the 2 lateral upper sides that you have right here, these 2. And then you have the corpus spongiosum, which is basically the bottom, and that is what contains the urethra. You of course have arteries and a lot of nerve endings. And when we look at the penis, we find that the corona, which is the ridge-like thing over here, is where we have a lot more nerve endings. In fact, that's the most sensitive part of the penis. The shaft of the penis runs from the corona to the base of it, and then the root would be here, which of course expands within beyond reach from the outside of the body. The meatus would be the opening through which the urine and semen are expelled, and that would be right here. And the glans of the penis, right, which is made up of this right here, would be homologous with the clitoris in a female reproductive system. Of course, the penis is sensitive to stimulation. The foreskin with individuals that may have not been circumcised is a fold of skin that can cover part of all of the cell, and depending on, for religious or cultural reasons, circumcision may or may not have been a common practice for the individual. Circumcision is nothing more than the surgical removal of the foreskin. Some people have claimed that circumcision would be the equivalent of clitorectomy, which we looked at chapter 5, but it is not. A clitorectomy would actually be, if we wanted to compare that to what it would be like in a male, clitorectomy would mean the removal of this entire part right here. That's what a clitorectomy would be. When you remove just the foreskin, you're basically just taking off the extra skin that's there. If you wanted to compare that to a female, it would be the removal or the cutting of the prepuce, which is the skin tissue that's also known as the hood that protects and covers the clitoris. We find that there are half as many nerve endings as the much smaller clitoris in the penile gland, so women do have a lot more sensitivity in the clitoris. Also circumcision, please note that is the most common male surgery in the United States. And also circumcised men, there are some things that are interesting. In 2010 there was a study that showed that circumcised men have lower rates of infant urinary tract infections and STIs such as herpes and HPV versus uncircumcised men. And female partners of circumcised men also have lower rates of certain types of vaginal infections and cervical cancer, per 2 studies, one in 2007 and then that which was replicated in 2010. Now, at the root of the penis, you'll find that there is the extension that goes to the body and below the pubic bone, and this is attached to a lot of internal muscles that can be felt in the perineum, the perineal tissue. That is basically the tissue that separates the anus from the penis. When we look at the internal part of the reproductive organs, I'd like you to see in here that, as we discussed, you have the glands of the penis, you have the urethral opening, and then it goes on to the inside. Now here at the top you have the bladder, and that is where we hold our urine. Here you'd have a testicle that produces sperm. Spermatogenesis goes up to the epididymis, and then it goes down to the vas deferens. This right here is what sometimes men that go through a birth control and they want to do the surgery, is what we call vasectomy. It actually is the cutting, the tying, the removal of this right here, the vas deferens. From there it travels through here and it goes through to meet and enter the urethral opening. Notice how this right here, which contains the semen and the sperm, unites right here with the bladder. And so we'll be talking about how the sperm and the urine are not necessarily deposited into a woman and why that occurs. It is important for us to know that the penis will become erect after specific types of stimulations perceived by the individual. Now, what stimulation we're talking about depends on the individuals because it varies from person to person. But we also know that the erection is a spinal reflex that can occur during REM sleep. We find that the arteries of the penis allow blood to flow into the 3 cylinders that we looked at earlier. When the veins compress and they prevent the blood from exiting, then it allows for the penis to remain erect. When the sphincter, which is the veins that basically the sphincter is this tissue that compresses the veins, loosens up, then the penis goes back to its flaccid state, and that's when the arteries are wide open to allow the blood to flow out. When we look at the scrotum, which is the part over here, the bottom, this is made up of loose and wrinkled skin that's underneath the penis, and that's what contains the testicles. Please note that this is covered with pubic hair, and the functions of the scrotum is to keep the testicles cooler than the body temperature to keep the sperm viable. Typically, testicles are 3 degrees cooler than our body temperature, and oftentimes professionals recommend that we men not wear tight briefs or jock straps because this has been shown to reduce the sperm count. This is because the body temperature, the temperature of the testicles starts increasing, and that does impact sperm viability. Also, in the scrotum, there is a muscle that's called the cremaster muscle, and this is the function of that is to move the scrotum closer or farther away from the body by contracting or expanding. We find the cool testicles basically lead to a contraction that occurs to increase temperature. It gets closer to the body, and so the testicles get warmer. But during the summer or in hot days or in the shower, the testicles that may be in a warm situation, they would be expansion, and it allows for the testicles to hang lower away from the body. The cremaster muscle also comes in handy when individuals have sex, and that is to keep injury from happening during sexual intercourse. Rather than allowing the testicles to hang really low, they actually hang a little bit closer to the body so that if there's movement, there isn't a very aggressive swinging of the testicles. Now, before we go on to and wrap up this module here, I'd like for you to get a visual of how the ejaculation takes place and what parts of the male reproductive organs are involved in ejaculation. As you already know, the penis and the testicles are involved, but the testicles were involved in this in here many, many days before the ejaculation of the sperm. So spermatogenesis occurs within here, and it starts expanding from the outside of the testicle to the inside. Little by little, throughout days, it begins to mature and get closer and closer to the center. Once it reaches the center, then it starts through microtubules migrating to the epididymis. The epididymis is this part right here where we actually keep sperm for a specific period of time while the sperm mature a little bit more. Once it's ready, it basically sits in there ready to be ready to start traveling through the vas deferens, and it goes from here to here, and it travels through the vas deferens, and it makes its first stop right here at a very important place, and that's called the seminal vesicle. Now, the seminal vesicle basically is where we get about 60% of the semen that's ejaculated. And so about 60% is gotten from here, and this contains a lot of rich nutrients that are going to protect the sperm so it could survive the very acid and not so inviting environment of the vagina. From there, it continues on, and it stops by the prostate gland that also contributes to about 25 to 30% of the semen that we can actually see when ejaculated. And then from there, it would seem that the logical thing would be for it to just carry on and go to the place where it's eventually going to be ejaculated from. However, before we go on to that, it's important for you to know that the Cowper's gland, which is this gland right here, a tiny gland, it seems to be out of the way. Look, it's going from here to here, but there's a detour here. Now, this is not going to come back. What we see is that the Cowper's gland starts releasing what we call pre-ejaculatory fluid, also known as pre-cum out there, and this is what is released prior to ejaculation taking place. When an individual becomes aroused, you start seeing that there is liquid that starts releasing from here. It serves to lubricate, but it also has a purpose, a very important purpose. Because we only share one cavity through which urine also comes out, and urine should not be deposited inside a vagina. That's why women have a urethra and a vaginal opening. We do not want the penis to actually deposit any urine inside. And so what the Cowper's gland does is that it's responsible for cleaning this particular cavity. This tract is cleansed by the pre-ejaculatory fluid that the Cowper's gland has. Now, it has been discovered that the pre-ejaculatory fluid does contain sperm. Not that many, and it doesn't get deposited with forceful fashion into the os, but there is sperm that has been found in the pre-ejaculatory fluid. However, once it cleanses this in here of the urine that we may have left from the last time we peed, and once we get to the point where ejaculation is going to occur, then there is a process that will consist of simply forcefully ejaculating and releasing the fluid, with a hope, according to evolutionary perspective, to get as close as possible to the cervix. Please be familiar with the overall male reproductive organs, and keep in mind again on how the anus, which we see here, and the root of the penis. Remember, we talked about how the perineum, which is the tissue in between here, this can be stimulated sometimes when you put some pressure when an individual is aroused, because the root of the penis is going to be responsive to any pressure from the bottom.